Okay. All right, well, let's go ahead and get started. It's about 11:31. Welcome to Oh My Aching Back, Part 2, tips to keep your back strong, safe, and supported. I thank you guys for being here with me today and hope that you got some useful information out of Part 1 last week. So let's get right into it. Just as I mentioned last week, my role in this presentation is not to replace any sort of relationship with your doctor for medical advice. And you always want to talk to your doctor before making changes to your diet or physical activities. And again, a little bit about me. My name is Brittany Hardup. I am bachelor prepared registered nurse, currently working on my master's. I'm your Cigna on-site nurse health coach. I'm available for coaching, health education, group education, all sorts of different things. If you have questions about medication, want to get a condition under control, all sorts of things. And fun fact, I'm a third generation Pinellas County native. So for today, we'll do a quick review from a couple of the things we went over in Part 1. We'll talk about some more pain management and some exercises. So as we discussed last week, we talked about a little bit of the anatomy of the back. So the vertebrae here, your spine has 26 vertebrae, including cervical, which there's 7 up here at the neck, 12 at the thoracic. Think of that from your shoulders down to right above your abdominal muscles. Your lumbar, there's 5 of those. Your sacrum, which is one piece, and your coccyx or your tailbone is the next. You also have muscles, tendons, ligaments, all that come from that from the spinal area that connect to those vertebrae, and then discs, which are those little cushions right in between each vertebrae. So most back pain, as we talked about last week, occurs in the lumbar region, and that's because that is part of the core that supports our upper body and our weight. The spine is built to be strong, flexible in many directions, and it protects the nerves that are inside. Our backs are really prone to injury just because the spine is at the core of all of our movement, and it's built on so many moving parts. And so protecting those bones and ligaments and tendons and muscles is super important. So we talked about last week that about 80% of adults will experience some back pain in their lifetime. Acute is going to be lasting a few days or weeks, and usually occurs from, maybe you were doing some, you overdid it with some exercise or some back related work, like lifting something, or maybe chores like pulling weeds out in the garden. Thankfully, this usually improves on its own, and there's no special exercises or surgery required. If the back pain continues for more than about 5 to 7 days, you definitely want to get in touch with your healthcare provider because you may need, just further assessment. Chronic pain is anything that's usually lasting about 12 weeks pretty consistently, even after an initial injury that caused some acute pain. And chronic pain can start out as an acute injury that just doesn't get resolved. About 20% of people that have acute short-term low back pain do move on to have chronic low back pain with symptoms that don't go away after a year. In some cases, treatment successfully eases chronic low back pain, but in other cases, pain doesn't go away even with medical and surgical interventions. So we talked about some of the most common causes of back pain, including overuse, injury, pressure on nerve roots, like from herniated discs or spinal stenosis, and osteoarthritis. And then some of the less common reasons are going to be things like bacterial infection in the bone or the discs, or a tumor. So acute pain is typically treated without surgery. It may be treated with over-the-counter medications, ibuprofen, Tylenol, Aleve, movement such as stretching, some light exercise, Getting up and moving can actually ease stiffness and relieve pain and encourage faster healing time. You can use hot or cold packs to soothe constantly sore, stiff backs. And you always want to use the 20 minutes on, 20 minutes off method to protect your skin. You also want to make sure when you're using an electric heating pad, you want to keep it, usually comes in some sort of fabric or cloth sleeve, and you want to keep it in that to protect your skin. Or if maybe you've misplaced it or it has a tear in it, you can always put it in like a pillowcase or in a towel. And same with a cold pack. You don't want to have that cold pack directly on your skin. You want to have some sort of barrier. So again, a pillowcase, wrap it in a pillowcase or kind of a thin towel or a washcloth. And a lot of people ask, well, should I use hot or should I use heat or should I use cold? Well, it kind of depends. You know, a lot of practitioners will say, do what feels best. If the main goal is to reduce your pain, do what feels best. A lot of the time, muscle pain, so muscle aches and stiffness, tend to feel better with heat. Heat will relax those muscles and allow for a little more flexibility. Also, moist heat helps a lot too. So if you have the beanbag heating pads or packs that you can toss in the microwave, sometimes you can also get them a little bit damp and put them in the microwave and then put them on your back. And if it's something, you know, like, so heat is really good for the muscles, but cold, if ice or cold therapy feels better, use that. And again, you can always rotate back and forth. So you want to practice ergonomics. So we talked about that last week, and that's making sure that your body is in proper alignment when you do daily activities, like sitting at your desk, lifting something, pushing, pulling, also even when you're sleeping. So ergonomics when you're sleeping, laying on your back with a pillow under your knees or laying on your side with a pillow in between your knees to keep good hip alignment and leg alignment. Also healthy habits like regular exercise, good sleep, proper diet, weight loss, no smoking or tobacco use. And again, if your back pain is severe or doesn't improve, you definitely want to follow up with your provider. They may want to try another treatment modality, or they may want to get some sort of imaging done to make sure there's not something more severe going on. So treating chronic back pain can also look a little bit like treating chronic acute pain. Heat and cold packs, exercise, medication, daily movement like stretching. Other alternatives would be, let's see, sorry, scroll down. So other alternatives would be things like meeting with a chiropractor or a massage therapist. You can also look into getting a TENS unit. That's a transcutaneous electrical nerve stimulation unit. You can find those on Amazon. There are some that are wireless, some that are wired, and they deliver small, mild electrical pulses to the nerves. They're not always effective at reducing pain, but sometimes they are. People tend to love them or hate them. Kind of depends on your source of pain, your pain tolerance, and just personal preference. It kind of feels like pins and needles. But what it does, how that works, is it's distracting the nerve endings from receiving the pain sensations. And so it's distracting your nerve endings by sending little impulses of electrical stimulation to those nerve endings. And it can be a really great alternative to medication because it's something that you can use pretty much all the time without having to worry about putting something else into your body. There's also acupuncture, which if you are on the county medical plan, you do get, I believe it's up to 8 acupuncture sessions included. It's a Chinese practice that uses really thin needles to relieve pain, restore health. It can help reduce inflammation of the muscles, and it works by channeling and like activating certain nerve pathways I just recently tried it, and it's one of those things where I always wanted to try it. I finally did. Really like it. Acupressure, a therapist applies pressure to certain parts of the body to relieve pain, but I will say that has not been well studied for back pain. Other modalities can include, especially if your doctor prescribes it, physical therapy, epidural injections or cortisone injections. And, you know, if it's continuing and some of these conservative methods of treatment haven't worked, it may be time to talk to your doctor about pursuing surgery. So there are 4 types of exercises that are good for your back. Again, make sure you're talking with your doctor before you really start an exercise program, because we never want to do more harm than good. So the 4 types of categories of back exercises include flexion, which widens the space between vertebrae. It reduces pressure on the nerves, stretches back and hip muscles, and strengthens the abdominal and buttock muscles. A lot of doctors think that strengthening the muscles of the abdomen can lower pressure on the spine, especially in that lumbar area, because they're so close together. Extension exercises, they minimize radiating pain, which is pain that maybe starts in your back, but you can feel in other parts of your body. So maybe that pain is radiating down the side of your leg or into a foot or your knee. Maybe it's, you know, cervical pain up around the neck, and it's causing some pain down your arm or into your hands. Extension exercises are thought to open up the spinal canal in certain places and develop muscles that support the spine. Stretching. Stretching exercises improve the extension of the muscles and soft tissues of the back. It can reduce back stiffness and improve range of motion. And aerobic exercises, those get your heart pumping faster and keep your heart rate elevated for a while, but they can often be difficult when you are having trouble with your back or you're in a flare-up. So that's a good one for prevention for after you're out of an acute phase. So here's some examples of flexion exercises. As previously mentioned, those flexion exercises, they widen the space between those vertebrae. So a pelvic tilt, you see here, is you're going to sit on a chair or lie on your back with your knees bent, as you can see here, and your feet hip width apart. Roll your hips toward your face, leaving your buttocks on the ground. Think about buttoning your belly button into your spine. So tighten that core as you tilt your pelvis. Get rid of the small space between your lower back and floor. So you're rotating your pelvis, rolling it kind of to your face and then back down to the ground while leaving your buttocks on the ground. Try 10 to 15 pelvic tilts per set, and you want to try 2 to 4 sets at a time with rest breaks in between. Crunches. So sometimes crunches can be difficult when you do have lower back pain. So obviously make modifications as you need to. But start with lying on your back with your knees bent at 90 degrees, and your feet should be flat on the floor and about 12 inches or a foot from your buttocks, and you can keep them together or keep them at hip width apart. So you're going to cross your arms over your chest, and you can see in this photo, but if that bothers your neck, you can put your hands behind your neck to support it, or you can also lay your hands and your arms at the side of your body. Don't put your hands behind your head. Just if you need to put your hands somewhere other than across your chest, put it behind your neck, not your actual head. Slowly contract your abdominal muscles, so tighten those abs and raise your shoulder blades off the floor. Remember to keep your head in line with your body. So don't press your chin to your chest. Keep your chin and your neck in alignment with the rest of your body. Hold the position for 1 to 2 seconds and then slowly lower yourself back down to the floor. And repeat these anywhere from 8 to 12 times in a set. Take a break and do another set of 8 to 12. Extension exercises. So here's an example of a couple of examples of extension exercises. Planks. You might be familiar with these. They're a great core workout. And when you do a plank, you can do these a couple different ways. So one way to start with planks is you can actually start with them, if you're a beginner, start on your knees and have your elbows on the ground. And then if you're ready to move up, go ahead and get down on, go from your knees and your elbows to then straightening your knees and supporting your weight with your toes. So then when you're in this position though, you want to make sure this picture, honestly, you actually want to have your buttocks a little bit downward more because you want to try to keep your whole spine aligned with your body. You want to tighten your core, tighten your abs. And then if you're ready for even more of a challenge, you can go from supporting your weight on your elbows to supporting yourself on your hands. So you can hold those for 5 to 10 seconds and then slowly lower yourself down to take a break. Do that for, 3 to 5 times, rest for 10 seconds in between, and see if you can increase the amount of time you hold a plank. Like I said, you could start at 5 seconds and try to build up to 30 seconds, maybe even try to build up to a minute. You'll know that you're ready to move on to the next stage of difficulty when you're not really needing any recovery time after you've done them. So a side plank, we'll come back to bridging, but a side plank, you're going to lie on your side with your knees bent and prop your upper body up on your elbow like you see here in the first picture. Raise your hips off the floor, as you see here, keeping your spine in alignment, and you're going to hold that for 5 to 10 seconds. And just like with the regular planks, take a break to rest, and then do it again. Tightening your core, keeping your spine in alignment, supporting yourself on that elbow. Now, if you're ready for a challenge, kind of like how in this first one, we went up from the elbows to hands, you can do the same thing with the side plank. If you're ready for a challenge, you can hold yourself up with the one arm with your weight supported on the palm of your hand. Bridging. So bridging exercise works the muscles around your lower body and hips. If this bothers you and is painful, don't continue. But you're going to lie on your back with both knees bent at about 90 degrees. You're going to tighten your core by pulling in your belly button towards your spine. Then push your heels. Make sure you're not putting the weight in the front of your foot at your toes, but push your heels into the floor. Squeeze your buttocks and lift your hips off the floor. To support yourself, if you feel like you need more support, you can move your arms from your abdominal area and lay them next to you flat on each side of your body. You want to hold the bridge for 5 to 10 seconds and then slowly lower your hips back down to the floor and rest for 10 seconds. Try to do 8 to 12 repetitions, resting in between each one. You want to make sure when you are in the bridge position, you can see the spine is in line from the shoulders all the way down to the knees. So extension exercises. Some beginner back extension exercises. You can lie on your stomach, like in this first picture, supporting your body with your forearms. You might also know this as what's called a press up. So you can actually start with your whole body on the floor and then progress to supporting yourself on your elbows. This is going to improve the extension in your lower back, as you can kind of see with this redlined area here. And so press your elbows down into the floor to raise your upper back. As you do it, relax your stomach muscles and allow your back to arch without using your back muscles. Make sure you take a nice deep breath out and also think about where your shoulders are. So you may find that your shoulders are up by your ears, but you want to relax those shoulders. As you press up, don't let your hips come off the floor. Hold this for about 15 to 30 seconds and then lower yourself all the way down to the floor to relax. You can then kind of crank it up a notch by when you press yourself up, again, keeping the hips and the pelvis on the floor, but pressing yourself all the way up with your arms. So no longer relying on your elbows, but putting your weight on your hands. And this is a beginner bird dog here. You start on all fours, hands and knees, and stretch one leg out, and then bring it back to a neutral position, back to your all four arms and legs. And then you do the other leg. If you want to do it as a more advanced position, this image has the left leg out, and then simultaneously you can reach the right arm forward and then bring them back together at the same time. And then you would reach the left arm forward and straight, while then extending the right leg back and straight. Make sure you are not curving your low back when you do these, and make sure you repeat it on each side. So again, you can do just the leg, or you can incorporate the leg and the arm simultaneously. And some stretches. So belly breathing. Focus on pulling muscles towards the spine when you exhale. Extend your belly out while exhaling, like you're filling a balloon. And then you can also try single knees to chest. So laying on the floor, bring one knee to your chest, keeping the other foot flat. Or you can straighten your leg, whichever feels better on your lower back. Keep your low back pressed to the floor and hold this position for at least 15 to 30 seconds. Relax your knee to the starting position, whether that's at the angle or if you have your legs extended on the floor. This helps work some of these gluteal muscles and stretches those out, along with stretching the spinal column, because you're pulling everything up to your chest. So it's elongating that spinal column. You can then progress to doing both knees to your chest at a time, and then returning to a neutral position. And some other stretches, the Piriformis. This is a great one. Start with your lying on the ground with a pillow to support your neck and your head. Have your one leg, go ahead and keep it at an angle here with your foot flat on the ground, and you're going to cross your other leg over, almost making like the number 4, with your foot just under your knee. So then cross your leg over your other leg so that your ankle is resting on, in this picture, the right knee, and pull it gently towards the opposite shoulder. So you're going to work on pulling, in this image, the left knee across your body to the right shoulder, but you want to keep your ankle here on the thigh above the right knee. You should feel a good stretch kind of in the hip and out towards the buttocks. You want to hold that for 15 to 30 seconds, relax, and then you want to repeat it with the other leg. Do that in a cycle about 2 to 4 times. Cat camel, this is a really great one. You start in a neutral position here with on all fours, kind of like we did with the bird dog. And you arch your back. Think about like a cat when it's, hissing or under a lot of stress, it kind of arches its back. So you want to arch your back upward, and imagine someone's pulling your belly button through your back up to the ceiling. And then come back to the neutral position, and then you want to push downward, push your abdominal area down towards the floor so that you're creating an arch in your back, and then come back to that neutral position. So you can hold that stretch in each position for anywhere from 15 to 30 seconds, go back to the neutral position, and then do the opposite. So cat, you're stretching upwards, camel, downwards. And another stretch here's one for your hamstring. You can do this one in a doorway by lying on your back with one leg through the open door. Slide your leg up the wall here, and you should feel a gentle stretch down the back of your leg. Hold the stretch for about a minute, maybe more if you can. And as the days go by, add a little more time until you can relax and let these muscles stretch for as much as 5 or 6 minutes on each leg. It's really important to keep your back flat with no arch. Do not bend either knee or keep your toes pointed. You want to keep your foot flexed. Keep one heel touching the floor at all times and the other touching the wall at all times. You may also find that the longer you do this, the closer you can get, like with your groin to the edge of the doorway. And you may be able to actually get that hamstring and get that leg up a little bit higher. But don't push yourself. If anything truly hurts, you're doing a little too much. Stretches should be, you're pushing yourself, but should not be overly painful. So aerobic exercise, you want to try to fit 150 minutes. I know that sounds like a lot, but that's less than 30 minutes a day of moderate to intense aerobic exercise every week. Or if you're a little more vigorous in your aerobic exercise, your cardiovascular exercise, about 75 minutes a week. So we've talked about when to see a doctor. If your pain continues for more than a few weeks, or if you're also feeling numbness and tingling, you may experience that in the hand, your fingers, or your feet or your toes. If the pain is severe and doesn't improve with medication and rest, or if you've had pain after a fall or an injury a few days later. Also, if the back pain accompanies other symptoms, such as a change in your ability to urinate, like you're now having trouble urinating, if you're having weakness, pain, or numbness in your legs, if you're having a fever, which can be a sign of infection, or if you're suddenly having weight loss that you weren't expecting. If there's ever a medical emergency, especially if you've had a fall or an injury and you're unable to move, or have lost sensation in any parts of your body after a fall or an injury, you want to call 911 or visit the nearest hospital. So some final points. Know your risk factors. We talked about some of those habits you can change and modifiable risks, non-modifiable risks. So things you can change are your exercise regimen, your weight, your ergonomics, smoking. Things you cannot change are going to be your age, your gender, your heredity. Maybe you inherited some bad back problems or other maybe a connective tissue disorder that make you more at risk. Make necessary adjustments to your workspace, so making your workplace more ergonomic with maybe a standing desk, changing the height of your chair that you sit in, or incorporating some sort of lumbar support in your chair. Talk to your doctor about your options for pain management, or maybe physical therapy, exercises, stretching, etc. Improve your overall fitness level, so practicing basic strength and stretching movements to help keep your core and back muscles healthy and strong. And explore other self-care treatments and techniques. Of course, run them by your doctor. Massage therapy, chiropractic care, acupuncture, and maybe a TENS unit that you use at home. So your back is important to your overall health and your well-being, because it's literally at the core of so much of your movement. It not only impacts your ability to lead a normal life now, but also as you age. Taking care of your back now helps you live a long, healthy, hopefully pain-free life, and helps you keep your independence down the road. I'll be sending out an email with some of the sources that we went over that I incorporated in the presentation both last week and this week. That way you also have a way to reach out to me if you have questions or anything you want to go over. I'll stick around for a few minutes in case anyone has questions, but that concludes the presentation. I'm going to go back to that very first intro slide so you have my number or my email if you want to reach out. But I really appreciate you guys being here, and thank you so much. I know there will be a recorded version that you can access later on. But again, thank you so much for being here. I really appreciate it, and I will email you guys, and I'm here for any questions if anyone wants to stick around.